Hey, it's Chuck, and today is November 22nd, 2014, and I am currently in Toronto. I am 10 days post-op, and I realized I haven't made a video in what feels like a really long time, just because leading up to surgery I was pretty busy. I had stuff right on the go right until I left, and it's really weird. This trip to Toronto, I originally was going to stay for about 2.5 weeks with my friend Alex, and he's had surgery with Dr. McLean as well, and I was going to stay with him 2.5 weeks, go back home, and everything would just kind of go back to normal. Like, I would just recover at home a little bit, and things didn't work out that way. The TCP, the Transcalendar project that I'm involved with, and that I'm in, and that I was promoting for a while, there's a launch party here, December 12th, and then there's also one in Montreal the week before that. And I really wanted to be a part of that just because it was a project that meant a lot to me. So long story short, I am here in Toronto until about mid-December, and then I'm actually going to take a trip before I go home and then get back into life and just face the responsibilities of working and paying off all my debt and whatnot. But until then, it just, like, a lot of this trip had to do with surgery. It was for surgery, and surgery just feels like kind of like not the main event going on. Like, it just, a lot of stuff feels like it's changed since then. Like, I just pretty much just picked up and left. I'm gone for a month, more than a month, and I wasn't really sure what to make of my time off of work and life, and I've had a lot of time to do things I never used to do, to sleep in every day, to relax, to watch endless amounts of Netflix, to eat everything in sight if I was hungry, or to not really eat if I didn't really have the appetite, or reading or not reading, or literally just everything and nothing. Like, I haven't really had that mental time to actually do that. And it may not seem like I have a whole lot of privacy because I'm staying with Alex and his daughter and 2 cats, and it's a 1-bedroom apartment, so it's kind of tight, but it's amazing. Like, I'm really glad he's putting me up for this, and he's taking really good care of me, and I really appreciate that. And it's been a really nice getaway just from life and work and all the things leading up to surgery that were happening. Like, it just feels like I got to put my life on hold to just kind of peace out for a little bit, deal with surgery, deal with anything I want to deal with. So, speaking of surgery, since I'm 10 days post-op, this is my chest. Looks pretty gnarly. I've got some pepperoni nipples and my incisions. Funny story. So, had my nips covered with this, like, sponge kind of stuff that was, like, sutured to my nipple. So it was like a protective little kind of, like, barrier thing before I got it taken off. So I just got that taken off yesterday at my appointment with the nurse at the clinic, and she took off all the little strips of tape that were over the incision lines, and so it's really, like, this is all just scabs, and it's really raised and gnarly, but underneath the tape, I totally thought those were my stitches. So I thought the stitches were just, like, huge and thick, and, like, no, it's just the scabs. So yeah, I'm 10 days post-op. Those are my nipples. That's how flat everything is. I had some bruising up here, but other than that, I stopped taking the pain medication a few days after. Like, I really was only taking it because I had some bad headaches that weren't going away, that I didn't really have. Like, one time I didn't, like, the one time it was bad, I just didn't have anything else to take, and I was kind of just sleepy and lazy, so I just took a T3 for that. But at least it went away, and besides that, I haven't really been taking any pain medication. I slept a lot. Right after surgery, I remember eating as much as I physically could. Like, the day before surgery, I didn't eat nearly as much as I should have, because I couldn't eat anything after midnight the day before surgery, and then I didn't go into the clinic until noon the next day, and then that wasn't even, like, the whole time that I was getting ready for surgery. So I went there, got put in my gown and the little slipper sock dealies, got my IV, which was not fun. That was probably, like, the worst part about surgery besides waking up, which that sounds bad, but waking up wasn't bad. Like I felt really groggy and really tired, obviously, but it was mostly just like how sore my throat was, and then the mask, like the oxygen mask on my face, was kind of making me feel really claustrophobic, and my throat was really sore, so I couldn't really think to tell the nurse, like, hey, this is bothering me. So she gave me a couple ice cubes for that, and then I just remember waking up, and I eventually got out of bed, and I wasn't really at the clinic for too long. Like once I was kind of like up and mobile and got the IV taken out and got the binder on. The binder was pretty uncomfortable, and that's what was causing most of, if not all of my pain, because it's on really tight, because with the double incision method with Dr. McLean, he doesn't use drains. Normally for a double incision, underneath the armpits you'd have drains that are going to take all of the excess blood out from your, like underneath your chest, because it could just lead to complications, and it would just, that's how a lot of surgeons do that method. But with Dr. McLean, from what I understand, he basically, like when he's going to sew everything or stitch everything together, it just like he does a method that doesn't need the drains. So you only get the drains if you're doing the keyhole procedure, which is a smaller incisions around your nipple rather than across your chest, which I've got about a bit of a gap there, so they go till right about there. So far, so good. Yeah, don't really have too much. I knew, like I was expecting most of it. Like I went into surgery knowing pretty much most of it. I was expecting a lot more pain. My appetite came back pretty quick just because I didn't eat for what felt like forever. Lots of sleeping, lots of, I slept in like this fold-away kind of style chair until I was able to sleep in bed. But I just got the suture spongy things taken off, and these, as you can probably see, are just like scabby and gnarly, and yeah, so that's my chest update. Haven't really been I just haven't feel like I haven't really been updating on my life a whole lot. Mostly because I started these videos as a way to kind of just talk everything out, and just because I didn't really have people to talk to at the time. It was a good way to just get everything off my chest, and now, as I'm realizing that I don't update a whole heck of a lot, is because I feel like it's just not the same. Like, I'm not doing it for the same reasons. Like, I was updating a lot mostly just for personal reasons. It made me feel a lot better. I wasn't super close with anybody when I started making YouTube videos, so it was just a way for me to unwind and get things off my chest. But now it just, I don't know, it's not first priority. Like, I'm just kind of, like, I still update a lot on my transition. Like, my Instagram is a big outlet for that. I enjoy taking pictures, I enjoy updating, I enjoy that kind of release where I can just, whether it's a picture of myself or things I'm doing, like I just feel like that's more of a go-to, more accessible kind of way rather than uploading a video, and it's kind of more my thing right now. So that's a lot of the reason why I haven't been updating, and I've kind of hit a point in my transition where I have less to compare to, per se. Like now that I'm 2 years on testosterone, I got my top surgery. Those were kind of like some bigger milestones that now that I've hit, it's harder to look back on before those times. Like, I always thought adjusting to not wearing a shirt would be hard, or I just feel like it would have been, like, I kind of was like easing myself into it before I left Saskatoon, and I was doing yoga, and I would just leave in a tank top, and I was just trying to kind of like picture what it would be like wearing one layer or no layers or what have you. But I'm happy to say that it just feels like I already forget what it's like before I got top surgery, which is super cool, but also kind of really surprising, because it just, like, I thought I would have needed time to adjust to my new body, but nope, it's here to stay, and I love it, and I'm doing well, and I'm really grateful for all the love and kind words and just the fact that I was in people's thoughts and they took the time of their day to show me a bunch of love. And it's really nice to know that I have all the people in my life that I do, because leading up to surgery, something that I struggled with was just feeling really alone and struggling with that. So I'm glad I don't have to worry about that. Or sometimes I just kind of forget until I'm reminded. But this video is getting really long, so I'm going to